Hi, everybody. I'm Mark Iskowitz, Editor-in-Chief at Medical Marketing and Media, and I want to welcome you to the first talk of Day 2 of Lions Health here in the Haymarket Cabana. It's called Moving Minds and Moving Pills, and I have two great guests here to discuss that with me. But before I introduce them, I just wanted to say, by way of introduction, that while many of our global counterparts have embraced unbranded movement campaigns, disease awareness campaigns and the like. For instance, the Philips campaign, Breathless Choir, that took the Grand Prix yesterday in pharma. U.S. pharma, on the other hand, remains to a large extent enamored with the branded campaign. You know, we're stuck on our branded campaigns. And MM+M has for the last 3 years surveyed a number of U.S. healthcare marketers, director level and above, to gauge their appetite for unbranded versus branded messaging. The latest survey was fielded late last year, in the beginning of this year, by MM+M in association with Guidemark Health, and asked about 2015 marketing budgets. So we're going to discuss that data today and reveal some of the 2015 findings for the first time, as a matter of fact, as we seek to settle what's been kind of a long-running debate about creativity versus conservatism in big pharma, and that is, are the conditions in place, budgets, attitudes, company cultures, for movement campaigns to flourish on the U.S. side of the Atlantic, as they have in Europe and South America and basically any other place that DTC branded advertising is banned. So without further ado, Matt and Maria, we're going to start with a warm-up question for both of you. Why is unbranded advertising an important part of the pharma marketer's armamentarium, and why should there be more of it in America? Matt, how about we start with you?
Sure. You know, every brand makes a promise to customers. Every brand has a narrative to tell. And, just be like our own personal brands. If I only ever introduced myself as Matt Brown, the marketer, or Matt Brown, the agency guy, and you didn't understand the full context of why I do what I do and the rest of my story, the rest of my narrative, you wouldn't have the context to why I lead the way I lead or why I do what I do. And I think brands are the same way. As agencies, we set out to create that brand narrative. What's the story of the brand? And you can't be a compassionate brand or an understanding brand and not represent yourself in the full spectrum of the story. So unbranded doesn't exist in the absence of branded. It's not a trade-off. It's the full complement of the brand narrative. What's your responsibility as a brand to tell your full story about why you exist and how you exist?
Maria, why is unbranded important for a biotech company?
Well, much like Matt was saying, it's about telling a story. And for us, it's not advertising, it's communications, and it's disease awareness and education. So it's really an opportunity to tell the story of a silent burden perhaps that a patient population is going through, and we're to elevate that, right? So through the mechanism of market research, ethnography, how do we get to understand people? It's really an opportunity for us to get to know folks and what they're going through and elevate the burden that they're going through. And also from a corporate perspective, it allows us to have an open relationship with advocacy, with patient communities. So we really see it as a way for us to contribute to the conversation and to elevate the journey and the burden that people are having with the disease.
So if anything, the appetite for unbranded has remained largely constant the last 3 years, with a fair share of marketers actually pulling back on the unbranded even more so, although that seems to have stabilized a bit last year. People are still kind of keeping their unbranded budgets where they are, as small as they are. So question number 2 for you both is, and Maria, will stay with you for a second, why is branded advertising like mom and apple pie in the States, whereas unbranded is struggling to gain a foothold, and there's even a fair share of those exiting this area?
Well, I think it really depends on corporate culture, and for Corda, doing non-branded is a part of our mission, and it's a part of our commitment to the community. It's how we feel we are a part of the community. I think there are also simpler measures for branded versus unbranded, so I think that may lend to it as well. And also perhaps in larger organizations, brand managers are a little more focused on their responsibility as far as brand sales go, and perhaps looking a little more broadly at corporate reputation and perhaps what an unbranded campaign could do for products that are coming down the pipeline might be a good idea.
I think the reason that budgets are reflective of the way they are today is because in the U.S., because I can, I do, and because budgets are becoming more restricted. Budgets are, these products are not the first to market. A lot of products we're seeing are second, third to market. We're trying to carve out space. We don't have quite the same resources we used to have. And let's face it, if I can put $1 against a brand and have a clear path to ROI, that's where I'm going to put my dollar, versus something that is harder for me to explain, harder for me to justify, not only the spend, but then ultimately what the impact of that spend was. So it's not I don't think marketers in the U.S. are irresponsible for not doing unbranded. I think they're probably doing the very corporate responsible thing. It's just at some point there has to be a balance for what's responsible for the brand and what's responsible for the organization. I think that's where we want to challenge organizations and brand managers to, you can do both. You can be responsible for your organization and responsible for your brand.
So let's move on to attitudes. We have the data here to confirm those speculations. Let me say first that this was the first year that we did ask American marketers about their attitudes toward unbranding, so we don't have that trend component to the data. But when we asked what factors cause you to increase your unbranded communications budget, most people said new product launch. So this kind of goes along, Matt, with what you were saying, kind of setting the market expectation, building the narrative. When we asked what factors cause you not to increase your unbranded communications budget, 62% picked the response, budgets are limited, and I'm not willing to forego that enhanced share of voice that I get through branded communications in order to run more unbranded. They also picked answers like disease awareness doesn't move market share, 21% said that. Another 20% said movement campaigns aren't as effective in connecting ROI. So maybe they're being a little short-sighted, maybe you need to see the bigger picture there. But those are the attitudes in place in the U.S. So question number 3 for our panel here, is that a misnomer, or are these attitudes correct? What have you seen from your experience vis-a-vis the impact on market share and ROI, or is it unfair to expect that from an unbranded campaign? Matt?
I think the attitude is correct for the time. I don't think marketers are wrong for the day. Today I can measure, this is what I can measure, this is what my goals are, this is what my objective is, this is the space that I play in. What I think is changing is, I'll give you 2 things I think that are really changing. One is these products are not living in a vacuum, and they are not, we don't have the blockbusters of yesterday. And so when you have the second or the third to market, one of the big trends we're seeing is we're seeing more marketers coming out looking for brand agencies 4 or 5 years out. I will tell you, of the last 3 major pitches that we've won, they have been products that are 4 or 5 years from launch, that they're already seeking a brand strategy agency, not a medical communications agency, not just that. They're looking for brand strategy this early on because the need for creating a marketplace for a product that would otherwise maybe be a Me Too kind of product. They're establishing a way to differentiate or create a new market, new nomenclature for which their product is the key that unlocks that lock, right? So I think that trend is pushing people to perhaps change an attitude going forward for the need for more unbranded. But I think the other thing is we're also getting smarter about using data. So we're understanding how to measure sentiment and what sentiment means towards brand effectiveness. We're learning customer intent. We're understanding what people's behaviors are and what their intents are, maybe where before it was sort of what we think they are, now we're understanding more so what they really are. And I think as we understand people more, we understand what they do more, it'll be easier to say to marketers, you can actually measure, there is a measure that comes out of unbranded. There is a measure of that part of your story. It doesn't replace the other part of your story, but as a component of your overall brand narrative, we have the ability to actually tell you that that's having an impact on the greater whole.
People tend to gravitate towards what they're used to measuring, and it's hard with unbranded. But I also think it's unfair to expect that from unbranded because again, it's patient education, it's raising the awareness. So they're not meant for that purpose, right? But there are other measures you can have from it, like we were saying earlier. Advocacy relationships. How do patients feel about what we're doing? Are we working with them to develop this? Are we hearing them? Are we putting their true voice into the things that we're developing? So. But I agree with your sentiment, Matt, about the existing marketplace right now.
And connecting with patients and advocates can then pave the way for your storytelling later on.
Yeah,
so it's another way it
absolutely.
may pay off, but it might not be in the numbers right away.
And it adds authenticity to it too, because we can put ourselves in their shoes as much as we want, but in reality, the only people that really know what it's like to go through that are the patients and the care partners, and then the physicians that are treating it, right? So it's for us to really make sure that we're listening and captivating, and then, creating back.
Absolutely. So perhaps a resetting of expectations is in order for what unbranded can really do and what it should do for your brand. Cultures. The wind-up here is that most U.S.-based healthcare marketers don't have cultural appetites in place for unbranded advertising that they do for branded. A full 16% said their firms simply don't have the cultural appetite for it. So question number 4 is, and we'll stay with you, Maria, What can companies do to increase the cultural appetite for this type of advertising given its value?
Well, I think clearly defining the ROI when it comes to a corporate brand and product brand perspective, I think that that's helpful as well, not to just have a traditional metric, but have how many relationships, how many advocacy meetings are we attending, how many patient focus groups or ad boards are we developing. That helps to establish different goals that we can meet. I think also highlighting the value beyond brand sales. So how do people feel about our organization, including managed care? How do our employees feel about the company and the work that we're doing?
Right now, our clients buy in a very traditional way. We're still buying in pharma the way that clients have always bought in pharma. I think the emergence of small and mid-sized biotechs, I think the emergence of new commercial entities coming to market, bringing their products to market, doing things in a very different way, I think is starting to shift that a little bit. But I think the reality is agencies, we have to teach our clients to buy differently. We have to teach them to buy the value of the brand and the narrative and the story and the strategy. I think until we go back to what's the value of the brand, what's the vision you have for my brand, and how do I tell that narrative, and put the brand before the cost, put the value of the vision before the financial scope, clients are going to buy in a very traditional way, and I think we have to challenge that norm.
How have you gotten internal approval for these kinds of campaigns at Accorda? I know you have done some unbranded, so can you talk about that a little bit?
Yeah, sure. So we're highly collaborative at Accorda. So our teams are made up of medical, legal, and regulatory, but from a conversational standpoint. So what I do mainly is we sit with them and we discuss some ideas, some possible directions that we have before I put pen to paper and create a brief or even bring the idea up the chain towards senior management, so that way we all have ownership. We all understand from each other's disciplines what the concern is. And a lot of times I'll say the ideas come from one of those divisions, either medical, legal, or regulatory, because we get into that creative environment and really foster the collaboration, and it's a safe environment. So we can talk about things that might not work, and then we'll understand why they don't work. So it's important to have a strong relationship with your medical, legal, and regulatory team and see them as a partner, so that you can be successful in bringing unbranded campaigns through an organization.
Do you believe the conditions are in place for movement campaigns to gain more of a foothold on the U.S. side of the Atlantic as they have in Europe, South America, and everywhere else that DTC is banned? Maria?
Well, I do think DTC done responsibly is a benefit to the patient and also to the patient and HCP dialogue. I also think that we need to be able to police ourselves and make sure that what we're developing is creating value in the marketplace, because otherwise we'll have people policing it for us.
Several things are moving us in the right direction. First of all, we have a consumer out there who wants transparency and honesty, and transparency and honesty is not just talking about how fast my product works or how safe my product is. Transparency and honesty is about explaining the space in which we play. It's about saying this is the value we bring, this is the promise we're making to this particular patient and this particular condition. And so I think the need for that, the pull from that from the consumer, will drive us towards a better balance of branded and unbranded.
Okay, now I want to bring up our special guest, Tina Fassetti. She's Chief Creative Officer at Guidemark Health. Okay. And she is a pharma juror, so she can tell us whether yesterday's results brought us any closer to meeting the bar.
Absolutely. Whenever we were awarding the Grand Prix, there was a lot of discussion about that. And quite honestly, I felt very strongly about it because, again, I think especially with devices, people are so used to the features and benefits, and I think that happens with our brands as well, our pharmaceutical brands. But this was just an opportunity to go beyond the features and benefits and really bring to life, at the end of the day, this is changing people's lives, and this is how device marketing should be done. It's using the corporate brand to be have a halo effect over the actual product. You don't have to tell every feature and benefit in that communication, and they can go to the website to find out more about those features and benefits. And it is about pulling people in.
And you're talking, of course, about the Philips campaign,
Philips.
Breathless Choir, which won the Pharma Grand Prix yesterday, and it was done by Ogilvy and Mather London.
Right.
So not a U.S. shop, but definitely an inspiration for U.S. agencies.
Absolutely.
Do you think that's a kind of a happy medium in the U.S. maybe, is to, like that campaign, incorporated some elements of storytelling, grand cinema, but still could be called branded, although the overall goal was disease awareness. It was kind of an amalgamation of the two?
Exactly. I think it's going to make our clients be a little more comfortable with, going, it doesn't have to be this black and white. Is it branded or is it unbranded? It's something that can marry both together in a very beautiful way. I think the other thing that was very enlightening for me as a juror was the brand doesn't go away, but what other problems can the brand solve? The Parkin sounds, wonderful idea. That was what was entered for an award, and that's what won a gold award. It wasn't the brand, it was this tactic that solved a wonderful problem for these patients, and then that became the award-worthy the thing that was entered in the award, and then all the tactics around it. The brand was still there, it didn't go away, but this was something that solved a problem, a meaningful problem for these patients. And so you don't always have to enter your whole entire brand campaign. You can enter an element of it and win an award for that.